Anyone who's ever suffered chronic pain knows you'll try almost anything to get relief, from lotions and potions to pills and various practitioners. Well, now there's a new home treatment. Marguerite Rossi takes a look at the latest machine that's promising big results for those in pain.
Anyone who's ever been to the physios has seen one of these little machines. It's called an interferential device, but we all know it as the gizmo that sends little electric pulses into our body.
They're basically stimulating the nerve endings. I find clinically that I think with a lot of people they basically have a soothing effect on the nerve endings to help relax the muscles.
Like most physios, Damien Allwood uses an interferential device on patients at his Birkdale practice.
They're kind of part of the treatment that we do. They're kind of the icing on the cake.
It's been the finishing touch most of us haven't been able to have at home until now.
I can use it at my convenience and when I'm in pain. I don't have to make an appointment to go back to the physio.
63-year-old Jackie Campbell has a dodgy knee. It's arthritic and she pulled the muscles behind it last year. After using all the tricks in the book, the Ultima machine has got her mobile again without the need of any drugs.
It makes bowling much easier. I use it before I go to bowls. I come home without any pain in the knee. I can now mow the lawn, where before the pressure on the knee was too much for me to mow.
Jackie's daughter Heather is a fan as well. She used the machine on her lower leg after having a nasty fall.
About a day of using it regularly, I got more movement in my foot, and within 3 or 4 days I was able to get up and walk on it again.
The Ultima costs around $350. Distributors of the TGA-approved machine say it delivers the same treatment as the larger physio devices, but in a small, portable form.
It's actually stimulating pain relief by stimulating nerves and sending a signal to the brain, which tells the brain to release endorphins.
The technology behind interferential therapy has been around for about 40 years. This particular machine is recommended for a variety of complaints like arthritis, tendinitis, osteoarthritis, spondylitis, sport injuries, swelling, bruising, even gastrointestinal conditions. But there's some very definite people who shouldn't use the machine. Those with active bleeding over your abdomen if you're pregnant, are taking Wolfrin, have a cardiac pacemaker, have epilepsy or a malignancy.
So if you have any of those sorts of conditions, you absolutely shouldn't be using it in those areas.
But it's said to be safe to use for more common complaints.
Tony, say I had tennis elbow, what sort of a treatment would that require?
Okay, well, basically we'd use a 4-pad treatment, and we just pop the pads onto your elbow.
The pads are sticky, so sit easily on the skin. You then choose the frequency set to a comfortable level where you can feel it.
Yes, I can feel that all the way down to my little finger.
Then sit back and relax.
Within a half an hour of the treatment, your elbow should be feeling pretty good and you can go out and play that game of tennis.
But health experts warn people shouldn't view a machine like this as a magic bullet, that they should still seek professional help to get to the underlying cause of their pain.
It's only a way of managing pain. It's not going to cure your pain.
For Jackie at least, the Ultima has taken away the pain of managing her sore knee.
I'd much prefer to use the machine than to take drugs.